Hi guys, my name is Dinara Bisimbekova and I'm a senior manager in health and safety department, mostly responsible for health issues, health insurance. So welcome on board and let's get started. I will try to make a short and sweet presentation and hope that it will be helpful, okay? So basically we will discuss two main things here, health background form and the health insurance. Okay, let's go to the health background form. The health background form consists of four big parts: vaccination itself and the health condition. I will not explain you this part. It's pretty clear and straightforward. I think that it will be filled without any problems. The only thing which is important here that this form must be filled and signed by medical provider, and he or she must identify their phone number and email in order to be in contact with us if we have kind of questions or queries regarding your health condition or vaccination form. Okay, let's go to the part one. It's required for all students. Basically here, we are asking you to provide us with the details regarding the vaccination against measles, mumps, rubella, diphtheria, pertussis, and tetanus. And we also ask the details about the TB screening. Okay, let me explain you a bit more about the vaccination. Well, some students may have vaccination. It's a combination, combined vaccine against measles, mumps, and rubella, or some people may have them separately, okay, against measles, against mumps, 1 dose, and rubella, 1 dose, okay. And here you need to identify the data when you were vaccinated. Okay, when it comes to the MMR, it's a 2-dose vaccine, and the different period between dose 1 and dose 2 shouldn't be less than 4 weeks. When it comes to the measles, the same, it's 2 doses, 4 weeks period between them. And mumps, rubella, Tdap, and TD is a 1-dose vaccine. And here is a point when you are vaccinated against Tdap or against, pertussis and diphtheria, tetanus stated as a Tdap, or against tetanus and diphtheria. Either one is fine. But please remember that this vaccination is not lifelong as the previous vaccination. Okay, so this vaccination must be stated within the last 10 years. It's not lifelong. MMR, measles, mumps, rubella separately, it's a lifelong vaccination and will be effective up to the end of your life. And the next point, if you were sick with one of these infections, please, you need to undergo serological test and show us the proof that you had these diseases, okay, in your history. And we need to see the date of the serological tests and the results. When it comes to the TB screening, you need to undergo PPT test, or it might be underwent previously. So we need to see the date when it was stated. We need to see the date when it was read. And we need to see the size of induration here. And the period between a placement and when it was read shouldn't be less than 3 days and more than 3 days. So basically, after 3 days, PPD test is written by medical providers. And here, medical provider also need to indicate the size of the induration. And if it's more than 10 millimeters, then you need to undergo the following steps. It might be either quantiferon golden test, or it might be chest X-ray, or both. And I explain you why. For instance, it was, let's say, 11 millimeters, and you need to undergo quantiferon golden test. Please indicate your data right here and result here. If it was positive or equivocal, then you need to undergo chest x-ray, and you need to indicate date here, results here, and notes here. In some countries, quantiferon golden test is not available. That's why you may skip this part and go right to the chest x-ray, okay? But please remember that if the PPD was positive, more than 10 millimeters, then you need to undergo chest x-ray. Regarding part 2, it's a mandatory part for students of medical school who will participate in clerkship in a hospital and will be involved in the invasive procedures. That's why you need to undergo HIV test and hepatitis B test that shows us the effectiveness of your previous vaccination against hepatitis B. So let's say you underwent the hepatitis B tests and your results was 10 milliunits per 1 milliliter of your serum. It means that your vaccination is perfect and it works. Then you are fine and you need to fill this part. So basically you need to indicate the data of your vaccination. If the results were less than 10 milliunits, then you need to identify actually undergo the new vaccination against hepatitis B, okay? And the period between dose 1 and between dose 2 shouldn't be less than 1 month. Between dose 2 and dose 3 shouldn't be less than 6 months, okay? And here we need the details of your medical provider. In some countries, some additional vaccination is provided against meningitis, HPV, and varicella. If so, please indicate data here. Basically, HPV is 3-dose vaccine, varicella is 2-dose vaccine. So we are looking forward to see the data of this vaccination. If you have special health needs, if you stated yes, then please explain what exactly. If you are stated, if there is a chronic condition stated here as yes, then we need to see the explanation, okay? And also the details. Okay, let's go to the presentation then. Okay. Nazarbayev University developed the basic health insurance coverage for international students, and all international students who are grant holders, they are covered for free. And the health insurance consists of inpatient care, outpatient care that covers also free medication, and dental care, medical evacuation, and sorry to say, but body repatriation. And the total coverage is 15 million tenge. Please bear in mind that chronic conditions that is not acute or pregnancy and delivery is not covered by the health insurance. That's why we ask you to work on this as well. And if you have chronic conditions, please bring your prescriptions, notes, and so on, so we could help you. How it works. So the health insurance coverage works if the illness is in progress, it's acute, and we need to help you in order to prevent the severeness or irreversible negative outcomes. And then we also covers injury and, death. Health insurance coverage. Acute illness defined with the following symptoms: if it's acute pain, fever, unconsciousness, bleeding, acute surgical conditions, etc. And here it's not limited with this list, believe me. And basically, coordinator of the health insurance define if the condition is subject for the coverage. This is pretty much it. Let me tell you, first of all, regarding the health insurance, one important thing. You will obtain the health insurance upon arrival to Kazakhstan, because the health insurance is effective here in Kazakhstan, and the coverage and the health services provided here, and it's not effective in your country, unfortunately. So here is my contact, and SHIP is a contact for corporate issues. If you have questions regarding the house, please do not hesitate to contact us. We are here to help you, and stay safe and well, and hope you to see you soon here at Nazarbayev University.